Hi, I'm Joe Miller, anatomy teacher for YogaRenew, and in this video, I'd like to give you a brief introduction to the basic anatomy of breathing, and maybe along the way clear up a couple of common misconceptions that I sometimes hear from yoga teachers and students about breathing. So if you're a yoga practitioner, you'll have a clearer idea of what you're experiencing when you're breathing, in particular when you're practicing yoga. And if you're a yoga teacher, you'll have more confidence in your teaching that what you're saying is really anatomically accurate. So we'll start off just very simply, why do we breathe? And of course, when I ask this question in yoga teacher trainings, I usually get the answer to stay alive, which of course is true. We all know that. But why is that? Well, the reason is that our cells need oxygen. They need oxygen to produce energy. And that process of producing energy produces carbon dioxide, and then we need to get rid of the carbon dioxide. So we need to be able to bring air in, to bring oxygen in, and take air out to get rid of carbon dioxide. And then those gases have to be circulated to our cells. That's the job of the circulatory system, the heart, the blood vessels. But the organ where the gas exchange happens is your lungs. They're located here in the chest. There's two of them, one on the right side, one on the left side, on either side of the heart. So the way that the air moves into the lungs and out of the lungs really has to do with creating movement. We expand the lungs to bring air in, and then we let the lungs shrink to let the air move back out. So I think this is really important to bear in mind, that breathing is very literally movement. In order to be able to breathe freely, it's important that we also be able to move freely. So what happens is when we breathe in, we expand the volume of the lungs. We essentially kind of open up the space within the lungs, stretch them open if you want to think about it that way. Technically, we'd say we're creating a region of lower pressure inside the lungs, and the air will move to follow that area of lower pressure. But you could also just kind of think about it very simply like you're opening up some space inside your lungs. The air is going to move in to fill up that space. And then when you breathe out, the lungs shrink. Most of the time, actually, that happens kind of automatically. You don't really have to do anything. As long as you relax, the lungs are kind of elastic, like rubber balloons. They'll shrink, and the air will flow back out. Although we also have ways of kind of using other muscles to help us to push a little bit of extra air out when we need to. So the important part of kind of the muscular effort of breathing really happens on the inhalation. We need to be able to open up the lungs, to expand the space, to create that space for the air to flow in. And the main muscle that we use to do that is the diaphragm. So the diaphragm is a kind of a dome-shaped muscle. It lies really between the bottom of the lungs and the top of the abdomen, so where your guts are. It's kind of dome-shaped muscle in the lower part of the rib cage. And when your diaphragm contracts, it pulls downward. It kind of pulls the roof of the dome downward. And by doing that, it expands the space above. That's where the lungs are. So of course that opens up the space inside the lungs, and we already know we make the space, the air flows in. And then when we relax the diaphragm, the top of the dome rises back up, the lungs shrink, the air flows out. So we contract the diaphragm to breathe in. And I think this might be maybe one of the most difficult things for people to really kind of wrap their heads around in terms of breathing. It might seem kind of counterintuitive. Like, how can we contract a muscle to expand the lungs? Well, we do, and the reason for that is that when we contract the diaphragm, we pull the top downward, and of course that's going to open up the space up above. So I sometimes hear yoga teachers say things like, expand your diaphragm to breathe in. And I know kind of intuitively that's what it feels like, because you feel your lungs expanding. But as a matter of fact, your diaphragm is actually contracting. The muscle fibers are shortening to make that happen. One way you might think about that, kind of clarify it, is since the diaphragm is a dome, right, the sides are running more or less up and down. That's actually where the muscle fibers are. So when they contract like this. They pull the dome down. Right? So first misconception, right? That we expand the diaphragm to breathe in. No, we don't. We actually contract the diaphragm, but by doing that, we expand the space inside the lungs. So now we also have to think about, well, we have stuff underneath the diaphragm, right? We've got all of these abdominal organs. What happens there? Well, when we breathe in and the diaphragm contracts and pulls down, it's going to push down on the abdominal organs. And as long as the muscles that are kind of holding these organs in place are able to relax enough, it'll actually kind of push the belly out of the way. So you might feel, and you probably have had this instruction in a yoga class also, that if you put your hands on your belly and you relax your belly, as you breathe in, that your belly kind of feels as if it's expanding. And sometimes people think, oh, that means I'm breathing into my belly. And I've heard sometimes people say, take the air into your belly. So that's misconception number 2. That's actually not what's happening. The air is going into the lungs, but you're feeling the movement of the diaphragm in the abdomen. So you have some muscles, of course, that surround the space of your belly. You have your abs. Most of us are probably familiar with those. You also have a layer of muscles in the bottom of your pelvis, which are called the pelvic floor. And when the pelvic floor contracts, it kind of lifts up, it pushes up on the abdomen. When the abdominal muscles contract, they squeeze in, and they also push up on the abdomen. So we could use those muscles to help us to exhale. But in order for us to be able to breathe in freely, ideally, to make sure that we're not kind of inhibiting the movement of the diaphragm, we want to have a little bit of give there. So when you breathe in, the pelvic floor actually relaxes a little bit. And when you breathe out, it rises up a little bit. And when you breathe in, the abdominal muscles may be able to relax a little bit to let that space kind of receive the downward movement of the diaphragm. Now, of course, we can keep our abdominal muscles and our pelvic floors contracted. We do that all the time. In fact, there's probably lots of times in a yoga class where you're doing that. If you're doing, let's say, crow pose, or something that really requires a lot of kind of vigor and strength, you're going to probably have some engagement in your abdominal muscles. You can still breathe, right? That's because your diaphragm is attached to your ribs. And you can also lift your ribs to expand your lungs. So your diaphragm, even if the top can't pull down, your diaphragm can actually also lift your ribs. So that might be misconception number 3, is I think sometimes people have the idea that in a diaphragmatic breath, that you're just simply only breathing diaphragmatically when your belly pushes out. That's not really true. Your diaphragm can move your ribs, so you might feel some rib cage movement. And in fact, most of the time when we're breathing diaphragmatically, we're really probably going to feel some movement of the belly and some movement of the ribs, so that we're kind of finding movement in both of those spaces. So why is it important to breathe diaphragmatically? Well, your diaphragm is the most efficient muscle you have for breathing. It contracts and relaxes multiple times a minute. Your whole life never gets tired. You do have other muscles you can use to help with breathing. Those are called accessory muscles, and they're important because sometimes we need to be able to fill up the lungs more fully, if you're running, let's say, or exercising vigorously. But under normal circumstances, we want the diaphragm to do most of the work. And so I think one way to kind of think about this and understanding kind of how we can let the diaphragm do its job most efficiently is to come back to that idea that breathing is really just about making space. Can we invite the space inside the lungs to open up, to receive the in-breath? Can we just simply let that space close to let the out-breath move out? And so if you think about it in this way, right, making space has to do as much with undoing or doing or not doing as it does with doing something. Yes, your diaphragm has to contract to breathe in, but you also have to let other muscles relax to let that movement happen. So breathing is as much about not doing as it is about doing. And that gets me to my final misconception I think sometimes people have about breathing, which is that sometimes people feel like, I really have to kind of breathe in a particular way, or there's a certain correct way to breathe, and I got to find out what that is, and and practice breathing that way all the time. And I would say that's not really true. There's actually many different ways of breathing, and your body is pretty good at figuring out how to breathe. Right? Up till you watch this video, you've been doing it your whole life, so you know you're doing it well enough. You're still here. Your body's very good at figuring out how to breathe. So you don't have to try to control that process. And in fact, I think for the most part, the way that we work with the breath in yoga is by kind of getting out of the way. You might think, well, maybe I need to kind of breathe in more because I need to get more oxygen in. Also, your body's very good at making sure you get enough oxygen, right? We don't have to really kind of micromanage that. Now, you might be thinking, well, I find that it's often helpful to breathe in fully, or I'll take in yoga classes where we're doing exercises where we're breathing in fully, certain pranayama practices. I love those practices. I think they're actually really important. But the main importance of those practices is that they actually help us to reset the nervous system. It's not so much about getting more oxygen in. Your body's already very good at doing that. But breathing is related to your stress response. And many of us, as I'm sure we all know, are kind of oftentimes very chronically stressed in our lives. And one of the ways that we can reset the nervous system to help us to de-stress is actually by directing our attention to the breath. That by slowing down our breathing, relaxing around the breath, getting out of the way of the diaphragm, we can send a message to our nervous system that everything's okay, we can calm down. And I think this is really one of the most important aspects of the breathing practices in yoga. It's really about helping us to reset our nervous system so that we can be calmer, more resilient in our lives. So to finish up, let's just do very brief little breathing practice. Come into a comfortable seat. You can sit in a chair or sit on your yoga mat, whatever's most comfortable for you. It's best to sit kind of more or less upright so that you can kind of allow your abdomen to relax and in fact put your hands on your belly. And just bring your attention to your breathing. See if you can relax your belly so that as you breathe in, you feel that there's a little bit of a movement of the belly into the hands. As you breathe out, you might feel that your hands and your belly move a little bit inward and upward. See if you can picture the movement of your diaphragm. It's contracting as you inhale. That's pushing downward on the belly. And then you let it relax and the air flows back out. Just a few more simple breaths like this. You don't need to try to breathe in more fully or more deeply. You don't need to work harder. But remembering that breathing is really more about letting go than it is about doing more. And as you sit and you breathe in this way, see if you can observe, how does this affect your mind? Do you have any sense of becoming perhaps a little more settled, a little calmer, a little more able to face the challenges of the day? All right, so I hope that was helpful for you. Again, like I said, I hope it helped to clear up a few misconceptions, such as the idea that we expand the diaphragm when we breathe in. Well, no, we don't. We actually contract the diaphragm when we breathe in. That's what makes the space inside the lungs. The idea that we need to do more or work harder to breathe. No, we don't really need to do that. Our bodies are very good at regulating breath. And in fact, to breathe, it's probably really more about just getting out of the way of the breath, letting your body do what it already knows how to do. So I hope this was helpful for you. If you're a yoga practitioner, hopefully you can remember some of these things the next time you're in yoga class and kind of observe what's happening within your body with a little bit more knowledge as you breathe in and you breathe out. And if you're a yoga teacher, I hope you have maybe a little bit more confidence that what you're saying when you're talking to your students about breathing is really anatomically accurate. So I hope that was helpful for you. If you'd like to learn more about the anatomy of breathing and the anatomy of yoga, check out my yoga teacher training courses at YogaRenewTeacherTraining.com. There you'll find anatomy coursework that will help you, if you're a yoga teacher, to kind of give you the tools to feel like you can be more confident in your teaching, that you'll be able to improve your sequencing, your cueing, that you'll be able to offer variations to your students, to tailor your teaching to your students' individual needs so that you can feel more confident, knowledgeable, and that you're a more valuable yoga teacher. All right, thanks so much for watching. I'll see you in the next video. Thanks.